Peace Patrol here, and let's talk about constipation. This is going to be a long video, so maybe you need to sit on the toilet, but definitely like, share, and subscribe, and so you can hear more about constipation and how to manage it. So as a pediatrician, I get this a lot in terms of referrals and how to manage pediatric constipation. It is definitely one of the more common things that we see in our office. And constipation can be caused by many things, right? So if you're a baby and you're learning to transition how to feed and eat purees and solids can be a time of constipation. If you drink a lot of milk, such as 500 mLs of whole milk or more, can cause constipation. Iron deficiency anemia can also cause constipation as well. And if you're a child between 2 to 5 years and if you're a picky eater, that can also cause constipation as your diet isn't varied in a variety of fruits and vegetables and meats and nuts and other types of things. Constipation can be caused by many other things as well. So for example, if you have a genetic condition like cystic fibrosis or Hirschsprung's disease or meconium ileus, those can also be causes of constipation. Other things like hypothyroidism can also be a reason for it as well. Sometimes having multiple UTIs, urinary tract infections, can be due to constipation reasons. And also poor diet in general. So if your teenager is not drinking a lot of water, is not eating a lot of fiber, and just has a poor diet and eating a lot of junk food, that can also lead to constipation as well. Not having a daily stool may not be a big deal, but sometimes it can be problematic, especially if there's symptoms with constipation. So what can that look like? Well, it can look like just tummy pain. Other times it's sitting on the toilet and straining and pushing really hard and getting these pellet-like stools. But sometimes it can also cause things like nausea and vomiting, especially after eating food because your tummy and your bowels are full of stool. Other symptoms of constipation can include urinary frequency, urinary dribbling, accidents, both having voiding accidents and stooling accidents. Sometimes overflow diarrhea where you don't think you're constipated, but you have stool that's coming around the hard areas of the poop. I've also had children missing school because they're constipated or because you're being bullied and so they have holding behaviors or they're regressing in terms of toilet training. Sometimes constipation, if severe enough, can cause bowel obstruction. It can also cause a lot of severe sickness such as sepsis and other very rare but also very severe conditions. Finally, things like celiac disease can also cause constipation as well. So if you have a child with eczema, not gaining any weight, and also is constipated, it's something that we need to rule out. So a lot of causes for constipation. The nice thing about it is that if you go to your family doctor, go to your pediatrician, there's a lot of non-medical and medical management of constipation, which is kind of nice because we get to work with the families and figure out what their goals are and how we want to best treat it. What's interesting about constipation is the idea that some of it is part of our control and some of it is not part of our control. So for example, where your bowels are, you have poop collecting there, that's under smooth muscle, whereas the rectal sphincter, which is where the poop comes out, that is under voluntary control because that's skeletal muscle. So just like how you work out your biceps, your legs, those muscles get bigger and smaller depending on how you use it. You can mechanically contract those muscles and control them. But smooth muscles, like the ones in your heart, the ones in your tummy, and ones in your bowels, you can't control those. Otherwise, if you were able to control them, we'd be able to control how we breathe, our heart rates, and other things, which is not really good. We need to kind of keep that under our brain's control. But what happens is when you get constipated, your smooth muscle becomes bigger and bigger because of all that poop that's collecting in your smooth muscle and your large and small bowel. So the problem is that when you actually do need to go to the toilet and you try to strain, nothing comes out because you can't push everything down from your smooth muscle down to your toilet seat. So how do we get things going? There are a lot of things you can try. So non-medically, you can try things like prune juice or pear juice, which have natural laxative effects. But of course, you don't want to drink too much because it can be quite sweetening and fattening as well. You'd also want to make sure that it's 100% undiluted, not from concentrate, because those are filled with a lot of sugar and filled with a lot of water, which is not the function of those types of treatments. Other things that you can do non-medically is increasing the fiber in your diet. So children also have to have fiber in their diet as well. It varies by age and by diet as well as gender as well, but generally around 20 to 30 grams per day of fiber is really important in terms of making sure that the stool is softer because it draws in water into the bowels. And so fiber can come from things like legumes, nuts, seeds, whole grains, vegetables. Those are amazing sources of fiber, so making sure to incorporate that into your daily diet. As well as water. So making sure that you're drinking anywhere between 1 to 1.5 liters of water per day, especially if you're a child or a teenager, is really important. Of course, you can always splurge on a little bit of juice or pop here and there, but only on occasion. What we really want is some clean, a good source of water. Exercising, running around, working out is also a good source because you're getting your body into motion. That can kind of jiggle things a little bit, but that can also help with constipation if you're thinking about things that are non-medical related. However, when those things don't work, then you go to your family doctor or your pediatrician, and then we could talk about things that we need to do. So there are many causes, like we talked about, so we need to do sometimes blood work or investigations like an x-ray or an ultrasound to rule out those things. Commonly things like iron deficiency anemia, celiac disease, or hypothyroidism, because those are so common. And if those come back negative, then we think that this is probably more functional or chronic constipation due to just buildup. And typically treatment can be as long as however long it took you to get constipated in the first place. So that could be 6 months, 1 year, 2 years, or even longer. So what does medical management look like? Well, we need to do a clean out for the bowels. We need to get all that poop out and reduce the stretching of those small, smooth muscles. So clean out can look like an oral clean out. So for example, taking stimulant or osmotic laxative. But it can also look like a rectal clean out that looks like an enema or suppository. You'll have to talk to your healthcare provider to figure out which one's the best, because rectal enemas, I can tell you, are not really kid-friendly. We rarely do rectal disimpactions because that is very traumatizing to a child. Last resort, because we want to try other things that are less harmful and less traumatizing. First and foremost, you can think about something like PEG, which is a type of insoluble fiber. It doesn't get absorbed into the body. You can hear it as Laxidate or Restoralax. It's very cheap, very affordable, doesn't taste like anything, mixes really easily with water or clear juices. And what that does is draws in water into your smooth and large intestines, making the poop softer, which is really, really key because it makes you strain less. And you can always increase and decrease it depending on the effect that you want. Because again, we don't want pellet stools, we want a smooth brown banana or the poop emoji. That's what we want every single day. Sometimes if you need something stronger than that, you can always think about a stimulant medication. A stimulant medication basically makes the bowels contract and pushes the poop all the way down until your rectum, where you can actually voluntarily open and drop those duds into the toilet seat. Those are only temporary, maybe for 1 or 2 weeks until we get whatever we need to get out. The most important thing is constipation is completely treatable. You just have to be very, very patient and very forgiving too, because a child does not like that experience, especially if you're toilet training them or they have accidents. And it's kind of embarrassing as well. A lot of kids at clinic don't like talking about their poop because it's embarrassing. But you have to be persistent with it. Sometimes you have to be on it for months to end until the constipation resolves and the smooth muscle can slowly get back to its normal caliber. So it can take quite a while of time. And if those things don't work, then you have to come back, regroup, and talk about things like fleet enemas, soap suds, and other types of more aggressive types of treatments for constipation. I usually recommend doing constipation management, especially for a clean out, usually on the weekend when the child is at home, not going to a birthday party or not going on vacation, because it's easier to make sure if they have any accidents, they're readily accessible to a toilet. Probably not a good idea to start constipation management during a school day. You don't want them to get embarrassed or have any accidents in school. And always, always, always check in with your healthcare provider to make sure you're on the right track, because you don't want to get backtracked either or backed up. So if you like these long form videos on pediatric management and how to manage things at home and how to ask appropriate questions to your family doctor or pediatrician, like below and let me know what you think. And if you have any questions, keep me posted.